Dr. Abul Kalam Azad sir, Honorable Pro Vice-Chancellor Administration, to come on the dais and to share his thoughts for the inaugural session.
Assalamu alaikum. Thanks everyone for inviting me, especially in this International Pediatric Conference Authority for inviting me in this occasion. So, if I consider being an administrator, I want to say something in front of you. If I consider once upon a time when I was a student, Bangladesh, in case of pediatrics, we are facing the growth retardation, diarrheal diseases, and malnutrition. At present moment, we have overcome, alhamdulillah, more or less everything. But we failed to overcome the malnutrition. Once upon a time, it was in the form of malnutrition, that is undernutrition, and that is marasmus and kwashiorkor, but we are now facing the obesity. Obesity is a very important issue in this place, not only in place, throughout the world. And if I consider the child and adolescent, near about 1 in every 10 is suffering from the obesity or overweight. So this is an important issue is that our children, especially even my son, is used to take all the food panda and kipathao. I can remember, so can I can remember. And when my wife cooked pulao, he ordered pizza. When he cooked pizza, she ordered for pulao. So this is a common trend in our country.
Right.
So if we consider this type of food or junk food, this is prepared from the trans fatty acid. I teach my students that fat from the cows or goat is 1,000 times better than the trans fatty acid. Because trans fatty acid is hydrogenated fatty acid, this is hazardous for the health and heart, and so we should overcome this thing. You gastroenterologists, pediatric gastroenterology should develop the concept in our country. This is a very important issue. Otherwise, we have to face a lot of trouble in future, because not only this, we day to day, because I am internist and my another subject is in MD gastroenterology, in the adult gastroenterology as a student. So I have to face the metabolic associated fatty liver disease. In 10 years, 11 years child, they present with the hypertension and they present with the metabolic associated fatty liver disease. So we should build up the awareness program. Another thing, as a adult specialist, every day to day we face another problem is diagnostic dilemma regarding the Crohn's disease or IBD. Yesterday's seminar I mentioned that there is a seminar already they are continuing, that is the pathology seminar, internal seminar of the pathologist. They are doing this with collaboration of the Royal College of Pathologists. So this I also mentioned, and there was a professor who was president of the Royal College of Pathologists. I asked her that we should develop some tool or something keys that we can differentiate the IBD from the tuberculosis. Because in adult, it is very difficult to treat. In every patient, usually we treat for the tuberculosis, anti-tubercular drug, then we treat the patient with the definite IBD treatment. So when I attended the seminar in the adult gastroenterology, Japan is very much advanced in this regard. When they develop in the GI tract, they usually do SMR, submucosal resection. So I will request they can help in this regard. And 2 days back, I already meet our special assistant to the chief advisor, and she's directly involved in this ICT ministry, and Professor Engineer Professor Hassan Manditaya, she mentioned that he wants to help us regarding the AI. So I will request you from Japanese delegates, so if you help us to pediatric gastroenterology department with this AI or something else, so they will help, it will help to diagnose this kind of disease. Because today we are dealing with the precision medicine. So once upon a time, teaching and everything was absolutely different. Once upon a time when I was a student, our teaching was teacher-based. Teacher-based means I have everything, student comes to me, I teach them, okay. Now everything is altered. Nowadays, every education is student-based, that is and evidence-based and curriculum, everything else. So I will request you, the society, so they can do the collaborative research work regarding the AI or is something else, because we have the opportunity, They are very much advanced in the research side. The Japanese in the subcontinent, not only in Asia, not only this Asia, also in the world, Japanese very much advanced. Because they are doing the SMR, this type of operation 10 to 15 years back. But we are now at present in radar, we are trying to build up this thing. So we are far behind from the Japan. So we need this type of seminar, international conference. From this, we can acknowledge, from the gather knowledge from them. Not only this, we also get academic or institutional support from them. I hope they will do this thing, and every success of this seminar. Thank you everyone for giving me to say something in front of you.
Thank you so much, sir, for your insights regarding our conference. We are delighted to